Acute care, severe back pain, new injury management. Here are some principles for you to consider as you begin to make your way towards healing. The first is watch the posture videos. Watch and learn and practice ideal sitting and ideal standing. The idea in ideal alignment is that you're stacking joints on top of one another and you are maximizing joint integrity and minimizing inefficiency and strain patterns. So that's what that whole posture talk is about, right? It's about putting the body where it really wants to be and it can therefore heal. So you first and foremost, you start there. Now, that being said, the sitting posture. For acute back pain, we have to talk. Because my first consideration for you is that you don't sit much. You really limit sitting. The reason for this is that in most cases, we don't sit ideally. And it's the most amount of compressive forces on your spine with the least amount of muscular support. So, in sitting posture training, I teach you how to sit properly with muscular support. However, if this is a new back injury, most likely your muscles are already in spasm. They can't take the increased strain of sitting correctly when it hasn't been trained to do so. Those muscles to sit ideally on most of us are weak. And now you have an injury. So to ask those injured muscles to do a new task might be too much for the first couple weeks. So I ask that you limit sitting as much as possible. So some suggestions are get a standing desk order if you're still able to go to work. And another consideration is that you don't stand too long. So now what do I want? I want that movement of position. I'd like you to sit maybe for a few minutes, stand, take a load off, sit for just a few minutes, come back to working and standing. Another consideration with ideal standing posture, which you'll know because you've seen that video, is that when you're standing prolonged to avoid sitting because of your new back pain, I ask that you shift your weight a bit, that you take a few steps and you try to have these little movements that keep activating your muscles to help splint and support you. So you don't want to stand like a robot and not move at all. You don't want to be at a keyboard and not move anything but your eyes. So that static position shuts down your muscles. So just a little bit of movement. I can watch this. I can shift so slightly onto my left just for a moment, back to the right. Now I'm balanced. I'm going to shift to the right a bit and then back to balance. Little movements to keep activating the muscles. But ideally, I want you to stand and then walk around. Do a little bit of work, walk around. Okay. Many of us in acute back pain, severe back pain, can't stand all day either though, right? The back is already in spasm, the muscles are fatigued, we're not strong enough, so we're getting compression through our injured ligaments and discs, and we hurt too much to stand that long. That makes sense to me. So of course you're not going to stand all day either. So work at an 8-hour job at a desk is challenging. No way around it. So is there a place in your office that you could find to lie down for a few minutes in the ottoman position? Even just a few minutes. Talk to your employer. If you're not at work and we don't have to deal with that, then for sure I want you walking and lying down. Lie down in the ottoman position for 20 minutes. If you can't take that much time, lie down for 10 minutes. Then get up, walk around. You're nourishing the joints when you move. And if you have to sit for just a few, okay. But then you go back to lying, and then you go back to standing and walking. So notice what I'm doing, changing position. And this allows fluid to be moved through the cells so that you can heal, so that you can decrease inflammation. So we're not sitting too long. We're standing as ideally as we can with little bits of movement, but we're putting walking in between and a lot of time lying down, and preferably lying in static back. I promise to start making these videos a bit shorter. I have a lot more considerations for the acute rehab, how to manage that new severe pain. So I'll stop this one and then pick up and see you on the next one.